Good afternoon, everyone. We'll go ahead and get started. Thank you for joining us. Today is Tuesday, November 10th, and this is the QC COVID-19 press briefing with our local health departments. With us today, we have Nita Ludwig, Administrator of the Rock Island County Health Department. We also have Ed Rivers, Director of Scott County Health Department. We had planned to be speaking on the topic of holiday guidance during COVID as gatherings move indoors. However, in Iowa, Governor Kim Reynolds issued some additional mitigation, and so that's what we will be addressing today. We're going to go ahead and start off with some case numbers. Nita, can you please give us the case numbers for Rock Island County?
Sure. Today in Rock Island County, we have 131 new COVID-19 cases, and that brings our total to 5,740 cases. Our deaths remain at 109 for our county, and currently there are 51 people hospitalized with COVID-19.
Ed, please go ahead with the numbers for Scott County.
In Scott County, as of 3:15 p.m., the Iowa Department of Public Health reports 6,894 cases in Scott County with 52 deaths. And that means the Iowa Department of Public Health reported another COVID-19 related death of a Scott County resident. The individual was an older adult, aged 61 to 80. We share our deepest sympathy with the family of this individual, and we are nervous about what our recent flood of cases will mean for increased illness, increased hospitalizations, and increased deaths in our community. We've seen an explosion of cases over the last week or so that has both of our departments quite concerned. In Scott County, recent case counts have been 200 to 350 per day. By comparison, there were only 321 cases in the entire month of June in Scott County. People are spreading the virus to family members and close friends, and our investigators are told of gatherings without social distancing and masking. These numbers are what we would expect to happen when people aren't taking the necessary precautions to prevent the spread of the virus. And this surge is challenging our ability to investigate cases in a beneficial time frame. In Scott County, we made the decision to hire additional contact tracers when daily cases were closer to 120 per day. And with the number of daily cases nearly tripling, we aren't sure that plan's still viable. We're doing our best, but this surge is nearly unmanageable. But at 11 a.m. today, Governor Reynolds announced enhanced public health measures that will go into effect Wednesday, November 11th at 12:01 a.m. These measures are aimed at the high case counts and positivity rates currently taking place across the state. These measures will include mask requirements for social, community, recreational, or leisure gatherings for all participants over the age of 2 in the following circumstances: whenever there are more than 25 people indoors and wherever more than 100 individuals are gathered outdoors. Gathering as a group greater than 10 must keep social distancing between groups and limit group sizes to 8 people unless it's a household group greater than 8. And all these restrictions apply to wedding receptions. Spectators over the age of 2 at youth and high school sports must wear masks and maintain 6 feet of social distance from others, and only 2 spectators will be permitted for each youth athlete. Restaurants, bars, and similar clubs, as well as bowling alleys, pool halls, bingo halls, arcades, indoor playgrounds, and children's play centers must ensure that groups are distanced at least 6 feet apart, and groups are limited to 8 people unless the group is in the same household, as we mentioned earlier. 6 feet of social distancing and mask wearing is required at salons, barbershops, massage therapy establishments, tattoo and tanning facilities. And last, all employers are asked to evaluate whether more employees can work remotely. We welcome these measures, but we're going to require your help. We're asking all residents of our community to look deep and decide what more you can do. Social distance, wear your mask, Stay away from gatherings, pay attention to your symptoms, stay at home and get tested if you have symptoms.
We are pleased to hear of Iowa's science-backed changes. In Illinois, we've followed the science with Governor J.B. Pritzker's Restore Illinois plan. That said, Illinois cases are raging too. The Illinois Department of Public Health announced more than 12,000 new cases in the last 5 days in the state. In Rock Island County, we added more than 1,000 cases in November alone. Our positivity rate is alarming. Today, it is at 18.8% for the 7-day rolling average as of November 7th. Right now, Rock Island County and the rest of Region 2 are in Tier 1 mitigation, meaning that there's no inside dining or bar service, and groups are limited to 25 or 25% of the room capacity, whichever is less. On Wednesday, 3 more regions in the state, for a total of 4, go into Tier 2 mitigations, meaning that groups are restricted to 10 or fewer. The change from Tier 1 to Tier 2 is based on metrics, including positivity rate. Our region is barreling toward those Tier 2 mitigations and may likely be there next week. If positivity rates don't come down over the next 2 weeks of Tier 2, a region would surge into Tier 3. And those include suspending the in-store shopping at non-essential retailers, indoor and outdoor recreational activities. These mitigations should sound similar because that's what we lived under in March, April, and May of this year. And in another callback to earlier in the pandemic, just Monday, Governor Pritzker indicated that he might issue another stay-at-home order. The order went into effect March 21st and was lifted May 29th. The stay-at-home order did work. When it ended, the state regularly added just a few hundred cases a day. During this time, Rock Island County also reported 0 cases on a few of those days. Again, today we reported 131 cases and more than 1,000 for the month. We are teetering on the point of no return. Science must lead us, but you must follow what it says. Wear your mask, keep 6 feet between yourself and others, wash your hands frequently, and stay home as much as possible, and especially if you're ill. Thank you.
Thank you, Ed and Nita. If any of our media partners on the call have a question, please type it into the chat. We did receive a couple of questions ahead of time that we'll go ahead and field now. The first 2 are for Ed. Ed, in regards to the new restrictions or mitigation measures in Iowa, are the restrictions enough? And do you think the governor is doing enough to stop the spread?
Well, we welcome the measures contained in Governor's proclamation, as we know that wearing face coverings and social distancing are effective in stemming the spread of the coronavirus. But we recognize that restrictions such as those being enacted in Illinois are also proven measures that could have a positive effect on mitigation. We're happy that the governor continues to state that all tools are on the table, and we hope she continues to review the data and implement additional mitigation, targeted or statewide, as needed.
Thank you. Another question, we'll send this to Nita. How concerned are you all of an even greater spike in COVID as people return home for the holidays this month and next?
Yes, I think we've been saying for the last couple of days that it is a concern. I think we're both very concerned about people gathering in large groups and even family members for the holidays, especially Thanksgiving. We really encourage it to only be your household immediate members and to just meet virtually or share in other ways this year and not get together for Thanksgiving dinners.
And Ed, how much concern is there with college students specifically returning home? Can you unmute yourself, Ed? Sorry, can you unmute yourself?
Can you hear me now?
Yes, we can.
Great. You may remember that early in the pandemic, there was a recommendation that people quarantine when they come from other districts, because at that point the spread was greater in other areas of the country. But as elevated as our cases are in Iowa, I don't know that that's a factor that is going to be of any great concern.
Thank you. Next question. Nita, we'll start with you. What are your contact tracers telling you about exposure and spread? What are we learning from the interviews?
Sure. Well, as you can probably imagine, with this many cases and this much transmission in our community, it is really everywhere. So we are seeing spread in some of the schools that we have talked about on past briefings. We also are seeing a lot in family members, household to household, people that have attended large family gatherings like weddings, funerals, birthday parties, etc. But it's really everywhere in the community. So that's why we are really preaching to be very vigilant and don't let down your guard. You need to act as though everyone around you may have COVID-19 and wear your face covering and keep your social distance.
And Nita, have you guys heard of any main sources of spread or trends that we're seeing recently?
No, like I said, it's really such high transmission. We're seeing young kids, middle-aged folks, older folks. It's really everywhere in our community.
And Ed, we can start with you on this last question. How are long-term care centers doing? Do you want to speak to Scott County?
Well, for a long time in Scott County, we didn't have any long-term care centers in outbreak. The last time I looked at coronavirus.iowa.gov, there were 3 listed with a significant number of cases. So as is happening across the county in all age groups, it's happening in long-term care facilities as well.
And Nita, do you want to speak to Rock Island County's long-term care facilities?
Sure, I would just echo that. We are certainly still seeing cases. I think the long-term care facilities are doing a great job. They are, with our positivity rate greater than 10, they are required in Illinois to test everyone twice a week. So they are doing that. We are getting any results and hopefully slowing the spread by doing that.
Thank you. Seeing no additional questions, we'll go ahead and conclude the briefing for today. The recording of this will be posted on Scott County Health Department's website as well as social media pages, so please look for it there. We do intend to have another briefing later this week, so we will be in touch. Thank you, everybody. Have a good afternoon.